Okay, everybody, welcome this evening to our training on occupational therapy. Before we begin, please mute yourselves so that we don't hear background noise. And the presentation is being recorded so we can put it on our YouTube channel later. So be aware that other people will be able to hear what you say. We have started the recording. Please ask chat questions in the chat box or direct message Maria. Hold your questions till the end if you can, because what we'll do is when we're done, we'll go back through the chat box and we'll answer the questions, and some of the questions may be answered as Miss Birch goes through her presentation. Again, we will have time at the end for questions. Come on. Okay. We have an ACDD questionnaire at the end, so we can get an idea of how it went, what your thoughts are, was it beneficial to you? And because we're funded by a federal grant that goes through the Alabama Council on Developmental Disabilities, we want to make sure that they get the feedback that they need to forward to the grantors at the federal government. And then two, we can see what you're learning. If there's something that you really felt that you need us to do, you know, put it in the questionnaire to say what training you'd like to see. I know one parent said that she wanted to see a self-advocate do a presentation. So we're looking for a self-advocate now who is a speaker as well. Yeah, so you don't have to click on the link yet because we don't have a pre and post test. We will have the ACDD questions at the end, and our interpretation services are available in English and in Spanish and Korean, and Maria will explain and Ms. Du will explain how that works. All right, in lieu of Dr. Christine Drew, I'm going to introduce Maria Gutierrez. I put Ms. Birch on there, but I forgot to take off Dr. Drew and add Maria. So go ahead, Maria.
Hello, everybody. My name is Maria Gutierrez, and I am the family navigator for the region number 4. I'm happy and excited that we had our speaker today to address questions and concerns about and learning about occupational therapy. And I'm going to say an announcement for our Spanish-speaking families to walk them through the interpretation channel. Para los padres que están escuchando esta presentación, si quieren escuchar la presentación a los intérpretes al español, favor de seleccionar el icono del mundo que está en la abajo de su pantalla y seleccione el lenguaje español. Hágame saber si pueden escuchar a los intérpretes. Gracias. Thank you, Dr. Hill.
Okay, and see, Ms. Gutierrez really runs the show, so I feel bad that I left her off. This must have been from, anyway, okay. I'm Dr. Doris Hill. I'm the director of the Regional Autism Network, and I'm one of the primary investigators on this ACDD grant, along with Dr. Christine Drew. And I'm an associate research professor at Auburn University, and I teach for the special education department. And before I hand it over to Ms. Birch, I was looking at her bio and really impressed that she has 2 children. She's married. She calls herself an autism mom, and she's an advocate for autism. She's a pediatric occupational therapist with 14 years experience from Union Springs. She's from Union Springs. She graduated from Tuskegee with a master's in science and occupational therapy. She has a good relationship with Enlightened Behavioral Consultations to provide OT services, and that require an Ozark. She has been recognized as the Power Woman by Power Woman magazine as one of the Women of the Month in the Spring 2020 issue. She's been featured in blogs as a young blazing entrepreneur in her own business, Play, Live, Learn Therapy in Ozark, Alabama. And I'll let her tell you more. Go ahead, Ms. Birch.
Good evening, everyone. I'm gonna get ready to start the presentation. I would like for everyone to keep in mind that the interpreters will be interpreting everything that I'm saying, so there will be some pauses in between it just to let them catch up with what I'm saying or what I'm talking with everyone about. How's everybody doing today? Good? All right. Y'all ready to get started, or we're gonna wait a little bit longer? Okay.
I'm going to stop my share so that you can go ahead.
Okay. Started. All right, now come on now. Bear with me, trying to get it started. Stuff up here at the top. All right. Once again, my name is Sharon, and I'm an occupational therapist. I've been practicing, as Ms. Doris was saying, for a long time. I am a very strong advocate for autism. I love what I do. I've actually come to love working with children. This is not what I set out for when I first graduated. I really had a deep, strong interest in working with older patients, but when I started working with kids, I fell in love with it. So today I'm gonna present to you about what is occupational therapy, and I say it's the superpower that makes a difference with your child. I'm admitting people in as well. The content that I will be going over today will be what is occupational therapy, what's the difference between occupational therapy and physical therapy, where can I find an occupational therapist, why would a child receive occupational therapy, what children diagnosis do occupational therapists provide for, what are the signs to look for when a child may need occupational therapy, how can a child receive occupational therapy services at school, what does an occupational therapy session and a treatment consist of, and how can you as a parent help your child at home. Now, when you look at occupational therapy, I like to break it down. We got occupation, then we have therapy, right? So when you look at occupation, if one person can tell me, what do you think of when you see the word occupation or occupational? Anybody? Any takers? Maria?
Well, something that you do, something that you are actively involved.
Yes, you're doing something, whether it's working, whether it's taking a bath, getting dressed, that you're doing something. Well, according to Webster Merriam dictionary online, I pulled just two things, and then I pulled one thing from the American Occupational Therapy Association. It's the act of occupying, possessing, or settling, or it could also be the state of being occupied, taken over, or settled. But the American Occupational Therapy Association looked at it as activities people of all ages need and want to do, whether it's making a meal, playing, children playing, or getting dressed. Now, when we look at therapy, you're looking at a non-medical way of treatment. It's non-invasive. It's very top surface. You're fixing something that's not surgical. Now, when we put it all together, occupational therapy, what are we looking at? We're looking at helping people participate in desired occupations. We're also looking at therapeutic use of self, which is being a part of your daily activities, and it's meaningful to you. So when you think of occupational therapy, you always want to think of the client, the activity, and the environment. That's what's important to them. And when we're talking about kids in occupational therapy, we're looking at them purely from a play-based point of view, because kids play a lot, don't they? All right. So I thought this was very important, because when you're looking at therapy, there are a lot of therapies. One that a lot of people confuse or ask me is, what's the difference between occupational therapy and physical therapy? All right, when you look at occupational therapy, we focus, the therapist, we focus more on your fine motor, your small muscles, that's your fingers, your arms, maybe your neck muscle. We also look at your trunk, mostly your upper body. And things that we address is going to be more functional in nature, whether it's eating, dressing, playing, learning, or growing. That's what we focus on. Physical therapy, they're going to focus more with your gross motor, your large muscles, your thighs, your hip muscles, your leg, your feet. They also look at your mobility, your ability to move through space, to complete your daily activities, navigating through your environment, getting to places that you need to be. Those are the difference between OT, or occupational therapy, and PT, which is also known as physical therapy.
I always think of activities for daily living.
Do you?
Yeah, is that?
Yes, it's activities, because activities of daily living encompasses a lot of things. Like I said before, it's your eating, dressing yourself, going to work, taking care of your family, cleaning up your house. All of that encompasses activities of daily living. All right. So the good question is, or the why question is, why would a child receive occupational therapy services? Well, here in hindsight, this is the law. It's the public law. It's Pub L 101-104. It was originally known as the Education of Handicapped Children Act. It was passed in 1975. It's your child's right to have equal opportunities as any other child. Their diagnosis does not make the child. So when you're wondering why your child is getting it, it's because it's their right to have it. It ensures that all children with disabilities are provided the same equal opportunity as their same age peers. And we want them all to have quality education, no matter their diagnosis, right? So pretty much when you're looking at your child receiving any type of school services, especially occupational therapy, they have a right to have that. And that is keeping it fair and making sure they have a good quality education. All right, so what children diagnoses do occupational therapists provide services for? We provide services for everything. There is no diagnosis that's better than the other or one that we won't work with. So I have a list here of different types of diagnoses. This is just a handful of them. We work with a big mass of diagnoses, but these are the ones that I chose that were more school related, that we may work with. Attention deficit hyperactivity disorder. And I'm not going to name them all, but I'll point out some of them. Autism spectrum disorder, behavior disorder. We look at developmental delays or disabilities. We look at developmental coordination disorders, a learning disability, intellectual disabilities. We also work with kids that have physical disabilities. And so there is no right or wrong when it comes to us working with a child. We also, which is not listed up here, work with children with dyslexia or dysgraphia. And so those are things, that we'll work on, and it does not matter of the diagnosis. When we're looking at a child, the diagnosis is what we know, but the symptoms is what we treat. So if they're exhibiting a certain type of sign or symptom, that's what we focus on, not so much of the diagnosis. The diagnosis just tells us, okay, this child has ADHD, which is attention deficit hyperactivity disorder. However, we're going to treat the signs and symptoms that impact their academics as far as their diagnosis. Now, I love this part of it because this gets more into, signs and symptoms that you can look for when you're trying to see or assess if your child needs occupational therapy. So what are some signs to look for when a child needs occupational therapy? Let's take a look at hand function, which is categorized as fine motor skills. Now, when it comes to fine motor, this is your very small things that your child probably can't pick up. It could be buttoning their shirt. It could be putting on their pants, tying their shoes. All of that is in the fine motor component. It could be difficulty using scissors. They can have weak muscles in their hands. All of that is what we look at when you're dealing with hand functions and fine motor. All right, let's take a look at sensory processing. What we have here, when you think of sensory, I want you to think of everything that, how you experience your environment, your taste, your smell, your touch, your balance, your ability to see. All of these things are within the bracket of sensory processing. And so when a child has issues in this area, they may dislike touching different textures. It could be soft versus a hard texture. They may love something soft, but hate something that's very hard. They may crave movement, which in a sense is not a bad thing. However, too much movement can make you dizzy, right? They may dislike loud sounds. They may have poor body awareness. If you've ever had or seen a child that loses their balance a lot, that's considered poor body awareness. All right, when we take a look at handwriting, all right, we got poor pencil grip. Have any of you ever seen a child that may grab the pencil or pen or writing utensil with like a fist? So that's what we call a poor pencil grip. They may write too slowly, might not be able to write at all. And I get a lot of kids that can't read at all. And so those areas, those three areas are some of the areas that we look at for signs and symptoms. All right. When you're looking at postures, and this also lets you know, another sign or symptom that your child may need occupational therapy. They may slump over in their seat, or they can't hold themselves up. They got to lay their heads down on their desk for writing tasks. As mentioned earlier, self-care skills. Some kids may have issues with self-feeding. They may have issues with dressing or undressing themselves. As mentioned earlier, having issues with tying their shoes. When it comes to visual skills, we're looking at things like not being able to do a simple, maybe, and I like to do the Melissa Doug 12-piece puzzles, which that is a little bit advanced for some kids. They do have puzzles where there's like 3 or 4, but they may have difficulty completing a puzzle or copying work from the board at school. All of that is up under that visual skills bracket. Now, we're looking at oral motor skills. There are a lot of things, signs and symptoms that you can look at when you're looking at trying to assess if your child needs occupational therapy. A child may have issues with chewing or swallowing. Of course, we do overlap with speech therapy a little bit in those regards. However, when it comes to chewing or swallowing or being able to navigate that spoon to the mouth, those are some issues that a child may have when it comes to oral motor skills. Attention span and organizational skills. I see a lot of students, they cannot keep up with their papers. They cannot make it to class. I see a lot of kids that can't focus. They move a lot. They just can't stop moving. They're fidgety, and the teachers are like always correcting them. Hey, Gabrielle, sit down. And so when it comes to that, that could be a red flag that your child needs occupational therapy. And pre-vocational skills, that would go more so into job related things. And so that area is probably more so for older kids, but if they have issues with that, that could mean that they need an occupational therapist as well. This phase here is what a lot of parents do not understand when it comes to their child getting occupational therapy. When it comes to the school system, there are processes that they put in place to make sure that your child gets the help that they need. So, how can a child receive occupational therapy services at school? All right, in that phase 1, that is the recognition of knowing that your child needs it. Now, previously, the slides before, I showed you different types and different types of ways to identify, how your child, may benefit from occupational therapy and some signs and symptoms to look at. So the first thing as a parent is recognizing, hey, my child needs occupational therapy services. And so once you recognize it, then you can move, to that second phase, which is pre-referral. Have interventionists who are on what we call the response intervention team. And so once we get this response to intervention team on board, the parents and the interventionist will work together to come up with a plan to help the child, try to get them, as far as their academics, get them squared away. You want to make sure that they get what they're needing. So this second phase is that phase where the parents and the response to intervention team will meet and they'll get a game plan together to make sure that child gets what they need. Now, if so happen in this second phase, the response to intervention is not successful, which means not that they fail, but the child may need a little bit more. So they will go to a phase 3, which is the referral. During this referral process, we're looking at special education services. The special education services will get the information from the response to intervention team, and they'll start building up just a file to see how we can help your child. Now, once we get that referral going, we're going to go through that phase 4, which is the evaluation phase. During this phase, we must have consent from the parents. We get consent from the parents on all phases because the parent is a part of each phase. But you have to actually sign papers to give us permission to test your child for extra services, for extra special education services. All right. Now, along in this phase, that's where the occupational therapists, if they need physical therapy, speech therapy, and there will be other, people on the team that will also do their evaluations as well. So during this phase 4 is where you will see occupational therapy do an evaluation. Okay, now we move it along to that phase 5. During that phase 5, this is where we meet with the parents again and we tell them all the results from phase 4. We're going to tell you, all right, according to the testing, your child needs more services. They need special education services. Or they can say the results yielded that your child does not need any special education services. So everything stops at phase 5 if they do not need additional services. Now, we move along to phase 6, the IEP process. So we've had an eligibility meeting, and then we'll turn back around and have an IEP process or meeting in that phase 6. Now, when you do that IEP meeting, what we're doing is putting an active plan together. I'm as the occupational therapist, I'm giving you my recommendations, my frequency, how many minutes I should work with your child, and everyone else is also putting together their plans of what they need to focus on, how much will your child be pulled, the frequency, and also the time. In that phase 7, we got IEP implementation. That's pretty much after this IEP meeting, guess what? I get to work with your child. The IEP is implemented, so guess what? That gives me the go ahead to work with your child and do my superpower. Okay. Phase 8. Now, this IEP reevaluation in the state of Alabama, and I'm quite sure they probably do it in other states as well. That reevaluation period comes up every 3 years. So not that you can't talk, you can have an IEP meeting anytime you want. But that IEP reevaluation, which has all those standardized assessments in that phase 4, that only happens once every 3 years. But remember, you can have an IEP meeting, or you can meet with this IEP team, which is the individual education plan team, whenever you need a meeting regarding your child. All right, so what does an occupational therapy session and a treatment consist of? Now, I just mentioned to you in one of those phases, the implementation phase, that I get to work with your child. So typically now, when I work with your child, most of the time, the recommendation will be once a week, 30 minutes, maybe 45, it depends. It's customized to every child. And we may meet once or twice a week. Now, to some, that may not seem like a lot, but here's the big picture I want you to think about. You not only have me working with your child, but you also have maybe, most of the time, speech therapy, a few of the time, physical therapy. And guess what? You still have your your teachers that are pulling them as well. So if you put all of that together, and we all are an awesome team, which the school districts I work for, the IEP teams and the special education departments are wonderful. We work together, and guess what? Your child makes improvements. No one person, I feel, can make an impact with a child. It takes a village. And so we're that village in the school. Now, what does my session consist of? I do a lot of different things. I only listed 3 areas, which was strength building, visual skills, and writing skills. During my 30-minute session, I am going to pack in a lot, but it's going to be quality. And I give my word to that. It's going to be a wonderful power pack 30 minutes of quality therapy. And the things that we're going to do is we may start off with some Play-Doh, and kids love Play-Doh. And that's a really good activity to build those finger muscles. We may even do ball tossing. We may do therapy, and that's a little bit harder and more difficult to manipulate than the Play-Doh, but we'll do something strength building, something fun to warm those muscles up, right? Then guess what we'll do? We'll do a visual skill. It could be lacing beads. It could be playing with puzzles, but we're working on something that will benefit your child in the classroom. When you're looking at visual skills, they need those skills to copy things from the board, to copy things in front of them, to write on their papers. So those visual skills are very important. Now, writing skills. I will use for an example, when we're doing kindergarten, the main thing that I'm focusing on at a kindergarten grade level, and this is just for an example, we're looking at the child's ability to identify those alphabets, to be able to write the formation of those alphabets. And also we're going to get into writing on 3 lines. So when it comes to those writing skills, we do a lot. And I'm using kindergarten for an example. But that's what we do during an active occupational therapy session. Now, this is the big question. How can you as a parent help your child at home? Being a mom of a child with autism that are on the spectrum, I find it very important to carry over, what the teachers may tell you to do, what your occupational therapist, physical therapist, speech therapist. It's very important to carry over as much as possible what they learned at school, at home. I think, as I mentioned earlier, it takes a village, and it definitely involves the parents, being the pilot of that village. And so my first thing is never be afraid to ask for resources for your child. If you're unable to find something, ask. If you don't ask, you'll never know what you can receive, from the teachers, from the therapists. Have a consistent routine as much as possible with your child at home. That is so important. So important. Sorry, hands got a little bit jumpy. But it's very important to have a consistent routine as much as possible, because your children, they crave that routine. Even in kindergarten, they have a routine. They take a nap at a certain time every day, and I promise you, your children look forward to that nap. Always carry over, and I just mentioned this, always carry over with your child at home for each therapy session or every day. Just see what they did that day. Maybe you can go over some math. Maybe you can go over the letter A, working on formation of it. Find different ways to engage your child with activities. Children are easily bored. And I put that in parentheses because with children, you have to be creative. They will get bored easily. And most of their attention span in pre-K, kindergarten, first, and even second grade, they need breaks. You really probably can't go over 30 minutes. So that is very important to, try to find different ways to engage your child. For example, you're teaching them alphabets. Instead of drilling them by writing it, make it fun by letting them make the letter A out of Play-Doh. That is another way to be creative. And guess what? You're still working on that letter A formation. Provide opportunities for your child, for you to be hands-on with your child. I know as a parent and, a business owner, working pretty much 40 plus hours a week, it is very hard for me to provide my children with hands-on opportunities, but I do try. I do it on the weekends. And so we will engage and do folding clothes. That is still considered a functional activity of daily living, and you're teaching them something that's going to last them forever. Everybody has to fold clothes. So I do incorporate as much as possible. I mean, they just helped me fold a load of clothes, and guess what? We killed 2 birds with 1 stone. Decrease time on using technologies. There's a pro and a con with this, because there are so many apps out there that have things on it that can help your child. But what I'm seeing now is kids will stay on their tablets or they'll watch TV all day, and it's nothing productive for it. Like they're just sitting there watching something silly, which there's nothing wrong with that. But you want to try to provide hands-on experience. I feel like it's the best thing. And maybe using that television or tablet as a reward so that they can watch it later. So as I come to a close, I want to leave with you that a diagnosis can predict the extraordinary love you have for your child. And also that your child's diagnosis, that is not your child. Oh, are there any questions?
Thank you, Ms. Sharon. I send you the questions on your.
Okay, I couldn't see them at the bottom. Now I gotta go see here.
While you're looking, I just wanted to say that I think it was great that you ended your session by saying your diagnosis doesn't define your child. So I just thought that was a very fitting thing to say.
All right. Now, okay. There is one, Maria, maybe you interpret it for me.
Okay. Okay. There was one that says if they could listen into the interpreters, but yeah, that was okay.
Okay. So the first question asks, okay, wait. What is dysgraphia? So pretty much with dysgraphia and dyslexia, both of those are is when your child writes in the reverse. The numbers may be in reverse, the alphabets may be in reverse. Let's say the number 3 it goes from left to right. They may write it upside down, or they may write it from right to left. So dyslexia, and also, which I know you didn't ask for dyslexia, but dysgraphia, that's when your child is writing the numbers and the alphabets in reverse. And it's hard for them to process. It's hard for them to input it on paper correctly. Like I have a child right now in the school, in one of my school districts. He can read, but when it comes to writing it, it's all jumbled up. And so the dysgraphia is definitely that diagnosis that may cause some intense, severe reversals, not being able to process and input information on paper or output it on paper. This question says, does that mean if my child can get, like you mentioned, wait a minute, I'm trying to make this bigger. Okay. When it went up, I couldn't see.
I could read you that question if you want to.
I was trying to find, I lost it.
Okay, so the next question will be, does that mean that if my child cannot, like you mentioned, opening jars and putting on his shirts and many more things, he could have an evaluation, but how can I bring my concerns to the school and the doctor?
Okay, so this is one thing that I did. So when it's dealing with school services, occupational therapy, it must be related to academics. However, I do work with kids on opening things, packages, because when you're in the lunchroom, that is school related. Opening packages, opening your milk, opening your fork, carrying your tray, all of that is school related. So it must still tie into the academics though. That process, those 8 steps is very important. So when you're bringing those concerns to them, they're going to want to take a look at their academics to see if something else is related to that as well. If that makes sense. And as far as bringing it up to your doctor, you can just say like, hey, my child is having a heart. It's really just simply just starting a conversation with your pediatrician and letting them know, like, my child is having difficulties with opening packages, jars, putting on his clothes. And so that should start that conversation with your pediatrician about, occupational therapy. But when it relates to school, it does have to be an academic component with it. But I do relate opening packages, that all of that is school related to me. Even tying shoes, because if your child falls on their shoelaces, I teach shoe tying in school as well.
And I guess the next question is gonna tie it up with the previous
Okay.
one. It says, you are describing my child. I asked the school for help and they told me no. What can I do? He's 10 years old and needs help to even unbutton his pants to go to the restroom at school.
So, because I've done the IEP process and I do have a child that does have an IEP, I always recommend to parents and to do a paper trail. Mm-hmm. And what that means is you have started the conversation and you feel as if, and I'm not saying that they're ignoring you, but you feel as if, you've told someone and no one has addressed your concern. So the next phase would be, I would definitely, send an email to the teacher, and possibly the principal and the special ed coordinator, because if that doesn't get the ball rolling, mm-hmm. They must not be scared of the state of Alabama, because that typically gets that ball rolling. They could say that you never talked to them. So that's why it's important to always follow up with the email. Hey, Miss, I don't know the teacher's name. I'm just using this for Miss So-so. I'm just following back up with you to see if have you had someone to look into my child getting an evaluation, or for occupational therapy, or can you get someone to come and talk to me? And I definitely think a paper trail will help with that.
That's a very good point. If you can get a notebook to put all your papers in and make sure you do everything via email, don't just go over the phone, because that way, if you have emails and you put them in a binder or something like that, what date you talk to them and what.
That is very important, because I'm not saying that the district would do that, but
Well,
you have
sometimes
to
there's turnover too in people.
Yeah.
So.
Yes, you got to follow back up. And I definitely agree with, sending an email. And I've even done certified letters. I've typed out a letter and I've sent it. And guess what? They have to sign for that letter. So, I mean, that has a little bit of money attached to it, but an email can get lost as well. But a letter that's certified and they got to sign for it, that will never get lost.
I also wanted to say that in the chat, I put the links to the YouTube channel and our Survey Monkey survey for the Alabama Council on Developmental Disabilities. It's in English, Spanish, and Korean. So if you could take a minute while we're doing the chat to fill out those surveys, that helps us get funding or keep funding, because they get to see the comments, and if there's something you think we can do better, please put that as well.
So here's a comment. I never thought OT could be helpful for daily activities. Thank you for this presentation. The next question is, can OT helps if my child is a picky eater and only wants to eat macaroni and cheese, but gags if he sees other foods?
Yes, we can. We can help with that. The child sounds like they have some very serious texture issues. And macaroni and cheese is pretty much very soft food. It's considered a soft, it's considered mechanical soft. It's almost like a Vienna. It's that soft. And so, yes, we can help with that. And I also like to work in congruence with the speech therapist, because that's in their domain too, but we can work with that as well. You definitely want to get with an occupational therapist that at least has some experience with that as well. Like, you don't want to just take your child anywhere, but we would definitely work hand in hand with the speech therapist with that. But that is a texture issue. Can you ask her, like, is there any other food besides mac and cheese that she has tried that's in that realm of soft foods?
He only likes mac and cheese.
Oh, okay. So I'm real big on like hiding things. Like, if a child likes a certain food, like maybe like putting like, maybe like a soft English pea in there to see if they'll like it. But I mean, that's still considered on that same texture. I'm a type of out of sight, out of mind. But my son is not he'll eat almost anything except for like Brussels sprouts. No, he likes Brussels sprouts. He doesn't like cauliflower. I don't know why, but Jace will eat a good little bit. So as a parent, you may have to get a little bit creative. Even though they like mac and cheese, you might could see if you can hide something, sneak it in the mac and cheese to see if that will help that palate become more trying something new. But there are different strategies that you could try, because mac and cheese, I love mac and cheese, but that's a lot of cheese.
The next question is, on the evaluation the school did for my child, they said he needed OT, but they only consider consultation for the teacher. However, I feel my child will benefit from receiving direct services. What should I do?
Because your child, okay, so they said consultation, and I don't want to, go over what an occupational therapist has done. I will come to you as a parent. As a parent, I would ask, to see if you can have another IEP meeting so that you can address your concerns. And I would ask questions as to why. I don't know if they explain to you the reason why you're doing consultation, but I would definitely have another IEP meeting, which I told you can have an IEP meeting. You could call it anytime throughout the year, because that is regarding your child. They cannot tell you how, hey, we can't have a meeting. You can call a meeting, you're the parent. I would definitely, get another meeting in order, and express your concerns and have some, I can't say proof with it, but tell them your reasons why you feel like your child needs more.
The next question, can a regular teacher at an IEP meeting present the findings of an OT that they didn't invite to present her findings? A lot of these questions sounds more legal.
Yeah,
but-
they are more legal. So say that one more time.
Can a regular teacher at an IEP meeting presents the findings of an OT evaluation that the school conducted but didn't invite her to present her findings?
All right. So I'm an occupational therapist that works in 2 school districts. I am so busy, and I'm just keeping it real. I am so busy. I barely get a chance to attend any meetings. However, if a parent requests for me to be there, I will be there. And I will keep it as simple as that. If you requested her to be there, or if you didn't, well, now you know you can request for us to be there. But if we're not there, yes, they can present. They can present on behalf of the OT because we do give a written report.
The next question, can OT services help a teen with poor organization skills? Like you mentioned, my child loses everything from pencils to papers.
Yes, we can. Yes, we definitely can. And I actually have a child right now. I spoke with the mom, and so what I did was, we're using a trapper keeper with him so he can keep up with his papers because it has a built-in file system. So we're trying that out with him to see if that will help him keep up with his important papers, any handouts that he may get. There are different strategies, definitely for sure, that you can work with organizational skills.
The next question, is it too late for a young adult that has really bad handwriting receive a OT?
I wouldn't say so, no.
The following question, for children with sensory issues like being too afraid of loud noises, can OT help? I am talking about even the blender and the vacuum at home.
So that sounds like a child that has auditory issues. And what we've done in the past, what I've done in the past, what I still do now, they have noise cancellation earphones, and that makes wonders. They're just earphones, they cancel out the noise, and the child is fine. Sometimes that will help.
The next question is there therapy for those with visual impairments?
Yes. They're actually Alabama, which she's in our area. Her name is Wanda, I think it's Sykes. She is our visual impairment, but it's not many of her. Like, she is like the only one in this area, and she covers multiple school districts. But we do have a visual impairment and hearing impaired specialist. Yes. I don't know, depending on y'all's area, they should have one. There's not very many in Alabama, though.
The next one is more like a comment. A therapist told me that my daughter didn't need it OT any longer when she was just years old. I guess the question that I will say is there a way for the school to prove that the child no longer is eligible to receive services? Is there needs to be something that needs to happen?
So every year, and I probably should have mentioned this, once a year, okay, every 3 years we do that standardized assessment. But once a year, towards the end of the school year, the parents, the IEP team, and the IEP team consists of your principal and administrator. You have a regular ed teacher, the parent, you have the special ed coordinator, and you also have I think it's 2 teachers. That is consists of the IEP team. All right. So every year you meet regarding your child, and it's an IEP team decision that decides whether your child doesn't get services or not. If the person that just come in did not have that opportunity, then she probably needs to go back and see why.
The next question is, how skills can be increased for someone who has hearing impairments? How skills can be increased for someone who has hearing impairments?
How can skills be increased with a person with hearing impairment? Okay, so when you're looking at hearing or visual impairments, I always go the route of more of a adaptive interventions or treatments, because if they've lost their hearing, that evidently that's permanent. So the route would be to put things in place, adaptive equipment, whether it's using Braille for a child with visual impairment. When it comes to hearing, they're probably using more of their eyesight, their vision. So you just put things in place that equipment in place that will help them with that. Because you can't fix a visual or hearing impairment. So you definitely got to use an adaptive approach with the equipment.
The next one, my son received occupational therapy out of the school, and the therapist told me that my son doesn't need it anymore, to let him take a break for a while. Doesn't this make him lose what he has already learned? I believe he needs to go on with his occupational therapy. What do you recommend?
Whew. Wow. I definitely would put it in writing. I was told, that my child didn't need this. So I would like to have a meeting, regarding the reason why, his services were stopped. Because the IEP team needs to do that together.
Okay. So the next question is, can you please provide the name for the visual therapy impairment? So is there a specific name of our specific therapy?
Brenda Sykes, Wanda Sykes, she's considered a visual, and I don't know are they in your area, these parents?
Yes, these are in
So I would have to, what I'll do is let me ask her, because I'm quite sure they all communicate with each other, who is in that area, because she's in our Wiregrass area. And so it would just be visual. She'll be seeing and hearing like a specialist. It's no particular name to it.
Okay. I don't see any other questions, but
Okay.
I wanted to ask you if you could emphasize on the importance of parents, taking what is being delivered, whether it is in the school setting or the private office, regarding with therapy, to bring it into the house and try to replicate. Why is that so important? And, what can they do, for example, if the child or the person only goes for 30 minutes, but usually is the therapist working in a one-on-one, right? And parents sometimes are waiting on the waiting room.
And so the question you're asking it, well, not question, but you want me to let the parents know why is it important, the carryover. So, and I always like to use my life, because I am a parent of a child that has a disability, and his disability is autism, of course. And the reason why carryover is so important is because guess who's with their child besides the teachers at school. But guess who's with the child on the other 50% of the time? The parent is. And so when you carry over, when you do things that they do at home, at school, or in a therapy session, from a therapy session, when you carry it over at home, I think that increases your child's chances of recalling it, being able to do it again, building their independence even more. That is so important. I will tell you this. My child is 13 years old. He can tie his shoes. A lot of kids that have autism cannot tie their shoes. They cannot take their own shower. They cannot put the food in the microwave for 30 seconds. We're starting with 30 seconds. But this came from carry over, and always just making sure that I'm doing what the teachers need me to do as well. So carrying over is so important. Even if you did 5 minutes, guess what? That's 5 minutes of carryover time that your child will remember. And kids remember when you do things with them. Kids remember when I do things with them. That's how I know you know that I'm working with your child, because they'll say, oh, Miss Sharon showed me how to turn my hand this way to cut my scissors. Or Miss Sharon showed me how to hold my pencil this way when I write. So you know I'm doing my job. And guess what? It takes a village for a child. It's a team effort. No one is left off. It's a team approach. Everyone's involved. Your teachers, your therapists, most importantly, the parents. You are the backbone for your child's foundational skills when they're young and until they're an adult. So that's the reason why carryover is so important. I cannot stress that enough. Hey, give them some bubbles. Let them blow it. Give them a pencil and give them some paper. Let them scribble. It's not going to hurt anything. It's just going to build up their muscles. Guess what? For writing. And they do a lot of writing these days. Too much writing.
I don't see any more questions, but I do want to thank you for saying that last part, because it's so important for our parents to listen, from a professional point of view, but also as a parent. So thank you for sharing that. I think that empowers a lot on our families. And, I think it's very important. Particularly, I think that, okay, there's a comment like, our OT was a lifesaver for my family. Okay, so I'm going to have to agree, that occupational therapists, they do play a big role on helping the child gain skills that are going to help them as they transition into adulthood. So the sooner that we start working with our children and requesting these evaluations, the better outcome. Okay, not every child is going to have the same needs. So that's what is so particular, that they receive their assessments and for people to follow up. So I don't see any more questions, just except that they say, thank you very much. This was a great presentation. Thank you for the presentation. Great presentation. So Dr. Hill, do you have any questions? Or Ms. Sharon, do you want to close with anything else?
Well, I wanted to say I do have a lot of resources. If your parents can give you feedback on like what they need, as far as like a handout for fine motor suggestions or different activities, or like with self-care skills, or I really want to send you the IEP flow chart process. I will send you that, because I really think that's very important for the parents to know. There is a process, but your child can get help. And just as long as that process goes the proper way, then, in paper trail, always email, always send a certified letter. Like if you didn't, if you didn't do that, then they can say you didn't talk to them. So, so if your parents that's on here tonight will let you know, like, hey, I need some ideas with X, Y, and Z, then I can send you some resources, and maybe you can have that on hand, for if they need something or ideas.
Wonderful. And also, when I'm going to send the PowerPoint once it's been translated to our families, and I will be sending the recording link. So I want to invite our families to make sure that you subscribe to the YouTube channel so that you get, alerts when there is a new video has been uploaded. So once again, that provides you with an opportunity to review it later on, on another day, make sure that you find the subtitles and, so that will be helpful for you. And I just want to say once again, thank you for presenting for us. And, I know that when I met you, we talked about this presentation. And so I do thank you for your time, and especially on a Friday and during the evening.
No
And
problem.
so thank you. This was wonderful. And
Do you want to put your email address in the
Yes.
chat, just in case somebody has a question or
ma'am.
wants to come to your clinic? I don't know.
Yes, ma'am.
also, I want to say thank you to our interpreters, Ms. Luciano,
Yes, thank
Ms.
you.
Iris, and Ms. Du. And thank you to our Korean families that attended today and our Spanish-speaking families. So, and other people that join us. So thank you so very much. We'll be sending the link, and please take a moment to answer the surveys so that they, like Dr. Hill mentioned, those help us tremendously and it's part of our grant. So we want to know what we're doing good and what can we improve. So Dr. Hill, do you want to close?
You covered everything. Thank you so much, Miss Birch, for coming tonight. The presentation was valuable for our families, and I think the chat showed that they were really thankful for your giving this presentation. So happy Friday.
I enjoyed it. I really did. I enjoy meeting people and educating. That is very important to me. And just helping more families. Very passionate about that.
We could see that. So thank you so very much. I hope that everybody has a wonderful weekend. An email was sent with upcoming events across the state that are fun events for the families. So I hope to see you in some of those, and just be safe, and we'll see you around.
Yes,
Thank you,
ma'am.
everybody.
Good night.
Bye-bye.
Bye.